Oh, I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not kept them.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck.
I like it.
Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect. Indulging deep combo, get hyped when she
What's going on? Welcome to an episode of Kidney Disease Education Moment. You know who I am. I'm Steve Belcher. Thanks for joining me. And look, this is not going to be like no hours, but this information needs to be out there to kidney warriors, dialysis access care, what you need to know. This is not the first time I've done this type of broadcast. However, the Spirit told me this evening to share information on hemodialysis vascular access, because with dialysis education, it's not just one time and it's over with. This is something that you got to keep repeating because the many patients that are on kidney dialysis. So it's not like a one-time shot. All right. Please share this broadcast. This is going to be some good information, especially if you have an AV fistula, an AV graft, a catheter. Some warriors may have this right here, a catheter. You may just got it, may had it 3 weeks, a month, and no one told you how to take care of it, or they may have told you, but not maybe emphasize some key important aspects of taking care of this type of access. All right, we're going to be talking about the needles, the taping down, how far apart you should stick, the type of dressings they use to cover your access. Some places only use a bandage and tape. Some places use what's called an opsite, where clear plastic, you can see over it. And then some other places just use what's called an island dressing, which is like this. Y'all seen them. If you haven't catheter, you've seen these type of dressings. So look, let's just hop right into it. Just to give you some basic information, if no one told you, and I'm not taking anything away from veterans, people who've been on dialysis 3, 4, 5, 6, 7, 8 years, who could know more information on their access about me because they're living it. I'm just an educator giving the information out so people who do have these access can take better care of them. And when they're in the center, they know about that access. So anyone new or technician or nurse that you never seen before or just straight out of training, they may do something wrong that you know is right. You can correct them. But if you know the information, you can do it. But if you don't know the information, then, it can lead to disaster, especially if you have a new person working on you. And with these many clinics that are out there, they have to train new people because people turn over, they get fired, they don't cut the mustard. And that's what I mean by patients suffer, because you don't get the type of care you deserve if a place is short of staff. You got people running around with 4 patients. They used to 3 patients. Now they got 4 and they can't even keep up. So you don't want someone to infiltrate your access while they rushing trying to get you on because they got another patient sitting outside waiting to get on. Or before COVID, there used to be patients that come into the treatment room and stand by their chair watching you like this, waiting to get on. How many warriors know what I'm talking about? You come in the unit and, your time is maybe 10:30 and it's about 10:45, 11 o'clock, right? You waiting to get on and the door locks. So somebody come out and the door about to close and you catch it, right? And you open it up and you walk on in. Because damn, you supposed to have been in your chair at 10:30. Here it is, 11 o'clock. No one came out to tell you what the hell is going on. Because they scared. No, they doing for themselves, right? So you catch the door, you creep on in, you go ahead and get your weight, wash your access down. You go to your chair, you see it clean, you see it there, and the technician dealing with something else. And you're like, damn, my machine ready and everything. And you sitting there watching them put on because we can feel it. Especially if I'm behind, right? And I can't get out there to let the patient know that what's going on. I don't blame them. But this is what I'm saying. That's the reason with the shorter staff and everything that's going on. Don't think all these clinics are going to be able to keep up with the staffing. No, they don't just spit out technicians like that. Not now and not these days. These days, the technicians are coming from Walmart. They may come from a doctor's office. I mean, and I'm not, saying anything is wrong. The reason why I'm laughing is because when people got into this field, they had medical experience. There was a GNA or medical assistant. They had some dealings with patient care, patient interaction, not customer interaction. So imagine taking someone who worked at a garage place, a shoe store, or something non-medical, and they don't have the dexterity, right? Your life is at stake. So the more you know, the better, especially in this day and time right now where there's a turnover of dialysis staff. And if you're on dialysis, please share this broadcast so we can get people here. We need more than 5 people, but it doesn't matter if we don't have more than 5 people. As long as the information gets out there, that's all that matters. Patient education. All right, let's get right into it. A hemodialysis vascular access. That is what's used in dialysis to get access to the blood. So we know that hemodialysis cleans your blood through a fistula. And let me show you a picture. This is a fistula right here. A graft or a catheter. Now, I don't have the pictures I showed before the show. Advertiser had a graft on there. I didn't download any, but a graft is a horseshoe shape, and it's a plastic tubing. Now, this is the catheter right here, as I showed in the beginning. This subclavian hemodialysis catheter. Now, if you have kidney failure, one of these will be your lifeline. If you got kidney failure, you're going to either have a graft, a fistula, or a catheter. Or if you do PD, you're going to have a peritoneal catheter or PD catheter. All right. So if you're at maybe stage 3, 4, almost about to hit dialysis, this show is definitely for you as well, so you can determine what access may suit you. You may even have an uncle, a mother, brother, sister who may be getting ready to start dialysis that haven't even crossed that threshold yet. This show is for them as well, because this can answer questions, kind of guide them through that process so they can have information that they can make an informed decision. Okay, so what is a fistula? All right, what is a fistula? A fistula directly connects an artery to a vein. The vein stretches over time, allowing needles to be put in it. Now, let me show you, before I move on, some of the needles. Again, this is a 17 gauge needle, and this needle is used. This is the first needle that's used to cannulate or stick a AV fistula. It's 17 gauge. We normally use these for 1 week, right? Start off with the 17 gauge at 200 milliliter blood pump speed, okay? And then increase each treatment. And then after the 17, which is the smallest gauge, well, 17, is large in number, but it's smallest gauge of the needles, okay? And then after a week of 17, after 1 week of the 17 gauge, you then increase to the 16 gauge. If your arm handles it, the access, then it's increased to the 16 gauge, which I have right here. Now, this is a 16 gauge, 1 1/4. All right, so it's long. It's normally used for patients who may have fatty tissue up here, maybe kind of large patients, and their arm is real fat and the access is deep. This is why they use the 16 1 1/4. All right. And then, but it's normally 16 gauge 1 inch. This is just a larger one. And then if everything works with the 1 inch 16 gauge, then they move on to the 15 gauge. 15 gauge 1 inch needle. And then they increase the blood flow rate up to 350 to 450, in that range. Some patients, they use 14 gauge, and I don't have that needle in front of me, and they increase the blood flow rate to 500 to 550 milliliters per minute. So fistulas are the gold standard for hemodialysis. That's the one they want you to have because it's your own veins. So what are the advantages of having a fistula? It's permanent. It's beneath the skin. It lasts long, up to 20 years. In fact, I met a kidney warrior back in 2006 who had hers for 30 years. Josephine Johnson. Longest one in the state of Maryland. 35 years or 36 years, the same fistula. It provides greater blood flow for better treatment, fewer infections and other complications, fewer hospitalizations. better survival, lower risk of dying than patients with catheter. That's just the truth, guys. Like I said, we don't sugarcoat nothing because we believe if you know everything, you can make an informed consent. We can't hold nothing back that is the ninth leading cause of death in the United States. So what's the disadvantages of having a fistula? It may not mature, develop. I've seen many warriors, unfortunately, go through this problem where the doctors put an access in their arm and it didn't mature or develop. That is very unfortunate. And one way that warriors, if you haven't seen a surgeon yet, this is one thing you need to ask them. If you don't have an access yet, and when they want you to go get a vein mapping, right, at the surgeon, ask him, how do your veins look? If he say your veins look small and still want to try, you tell him no, you want to get a second opinion. You don't let them put access in, they say your veins are small, because there's a high percentage chance that access or that fistula is not going to mature. And then they're going to want to start doing surgery on your arm and trying to raise it up to the surface and stretch it and this and that. And you're the one in pain, and then you got a catheter at that. I've seen too many warriors go to multiple access failure. Ask the hard questions before they start surgery. Are my veins good enough? Can I use my leg? Some warriors, you may want to use your leg. I've seen people with access in their leg. That way it can't be seen in your arm. You can wear shorts. You got fatty tissue down there. You got a large vein. Yes. Or ask about a buttonhole where you can go in the same spot each time. Develop a track. Another disadvantage is usually cannot be used for at least 6 to 8 weeks. You ask a lot of warriors, it takes a time to mature. And a lot of times you got to put pressure on that arm like a tourniquet, do exercise to increase that blood flow so you can dilate that vein so they can stick that needle in there. You got to do those exercises. That's very important. Very important. All right, let's talk about the graft. Now, again, I don't have material for a graft, but follow me with your imagination. If you've seen Gore-Tex graft materials, like a flimsy material, polyurethane, it's more flimsier than this, right? And so what happens, they insert it in your arm, put surgery, and they go under the skin and connect it to two veins, the artery and the venous. And so blood is flowing through here under your arm in this graft, right? Let me see if I can show you a picture of it. All right, so let's talk about the graft. A graft is a tube. Share this broadcast, guys, because we need warriors. We need warriors here to know this. Their family members. What about the elders? What about our elders who are in dialysis that can't speak for themselves? What about them? The 60, 70, 80-year-old. We got to have that backs too. We got to come together as a community. I'm not saying we're not, but in order to catapult this movement far as education and awareness, we got to share and we got to support each other to make this happen. So a graft is a tube usually made of plastic that connects an artery to a vein, allowing needles to be put in it. Grafts are the second best, not the first, but the second best. But some people can't get the first best, so they got to go with the second best. But sometimes they put the second best in people when they should have had the first best. Yes, this happens. The advantages is permanent beneath the skin, may be used after 2 weeks in some cases, may work in patients with poor veins. The disadvantages are more than advantages. Increased hospitalization, increased risk for clotting, increased risk for serious infection, increased risk for other complications and repair procedures. Does not last as long as a fistula. How many warriors have a graft that failed? Now you got a second or a third graft. How many warriors had a graft less than 5 years? How many warriors had a graft more than 5 years? How many have multiple access? This is everything that comes with kidney disease that a lot of people don't know before it happens. And that's why we do these education videos, so the more you know before it gets to that point, the better you're prepared to act on it before it happens. That's why we want you to share this broadcast so other warriors don't fall into that same pattern or predicament or situation. They may not know that the graft, you had increased risk for hospitalization, or you're at risk for clotting, or that you increased risk for serious infection, or you had increased risk for other complication and repair procedures. How many warriors had repair procedures on their access? I know many throughout my 33 years. So that's why education is critical. How many people before they got on dialysis and when you went to get your access done, if you would have knew this information, it could have helped you. You at the dialysis clinic, you got this in you already. You don't feel good, but you still need that information. So when you go to the surgeon, you can make a critical decision, informed decision on what you need to do. Now let's talk about the catheter. A catheter is a tube inserted into a vein in the neck or chest to provide vascular access for hemodialysis. The tip rests in your heart. It is usually a temporary access. It is the third choice for getting access to the bloodstream for hemodialysis. For some patients, it is the only choice. It is the only choice. And it would need to be used as a permanent access. Now, what about those warriors? What about them? Who's going to educate them? I don't see any other broadcast having these education moments, letting warriors know who have catheters that cannot have any other access on how to take care of them so they can maintain a quality life. Now look, there we go right there. You see that? That's the tip in the heart. If you haven't accessed a hemodialysis catheter, this is how it's resting inside your body if no one ever showed you or told you. I'm showing you now. Now look, it's only one advantage of having that. One advantage. It can be used immediately after placement. That's the only advantage. But first you got to get a chest x-ray. But what if you land in the ER and you need emergency dialysis, like right now? This is what they're going to put in you. It's called the IJ catheter. It goes right into your jugular vein. That's where it goes. Right? And we come in and we hook you up right through the red and the blue line. Now, who's going to tell you that if you got diabetes and hypertension right now, and let's just say you at stage 4 kidney failure? And I hope you're not, but unfortunately there are warriors out there that are at stage 4 and stage 5. That's the nature of this damn disease, because it's the 9th leading cause of death in the United States. So if you find yourself at stage 4 on the brink of stage 5 with a GFR of 10, 6, 5, and you end up in the ER, and you in respiratory distress, this is what more than likely they're going to put in. And I'm just telling you the truth so you can be prepared. And hopefully it can lessen your anxiety. And then they put this in temporarily, right? And then if it goes to chronic, we pulling this out and we putting this in. Okay? This is going to be in when you discharge from the hospital. And when you go to your first outpatient dialysis center, and your kidney doctor's going to come around, then they're going to start talking to you about getting the vascular access. You know why? You may not be ready for it because you may be traumatized. The new normal has happened. Hemodialysis, something you've been avoiding for years. But listen, you know why they're going to pressure you? Think of it logically. You remember what I told you about the catheter? It says, now check this out, A lot of people miss this. Now follow me. A lot of people miss this. And Spirit just came back and said, share this information. It says, for some patients, it is the only choice, and it will need to be used as a permanent access. All right, so follow me here. You just get hit with kidney failure, right? You want to hold off on getting that thing in your arm because of, I don't know, maybe unknown fears. You may be getting a transplant soon. You just don't want it, or you seen other people go through horrible experience, right? And then the doctor and the nurses and the technicians come to you, right? And say, oh, you want to get that catheter pulled. But let's say you taking care of it, no infections, and they coming to you, oh, you got to get that taken out because of infection. But I just read to you, for some patients, it is the only choice, and it will need to be used as a permanent access. You know why they want you to get it taken out? Because it will help that clinic numbers, right? They got to report certain numbers, how many patients have catheters. CMS pays them more. So the less catheter patients, the better they'll look their scores. If you don't take my word for it, go out and ask some of these dialysis patients like Don Edwards or Jim Myers or people who, the Kidney Foundation, any of those guys about quality care and patients with catheters. Google it, whatever. That's why. Only if you fall at a serious risk of having a catheter and it needs to be pulled, don't let them pressure you into something you're not ready for if you know and you're taking care of yourself. I just read to you from, this is from the government, the first choice for hemodialysis, fistula first. I'm not sharing no bullcrap with you. This is evidence-based information. If you want to read it for yourself, go ahead. It's right there where it says catheter at the bottom. So my point is, don't let them give you that hocus pocus. If you're not ready to get that catheter out, you're just not ready. Don't let nobody bully you or try to, persuade you into doing something if you're not comfortably ready, and if you don't have the information you need to make a sound decision on what you want to do. If that catheter is working for you, and if it's not clotting up and going through any type of mechanical problems, no infections. And I'm not saying, all right, because I did put my disclaimer out there. I'm not saying don't do that, but I'm just reading you something that logically, if someone else, if it's permanent for someone else and they got to have it until the end of time, then why can't that happen to you until you make a decision on what you want to do? You just do the same thing they do to keep it clean. So I gave you the advantages and disadvantages of the vascular access. Let's just go over and talk about the care of the fistula or graft and what you should do to keep it working well. If no one told you this, the urban health nurse is going to tell you this. 1, wash your access each day using antibacterial soap. Even if you're not at dialysis, get yourself some antibacterial soap and clean your access every single freaking day. Seriously. 2, before each dialysis treatment, wash your access at the sink if they got one at the unit. If they don't have one in the facility, which they should, go into the bathroom, but make sure you wash your access before you sit in that chair, period. 3, your access should be disinfected by your dialysis caregiver before needles are placed. And speaking of that, if you have an access of a fistula or a graft, look, when you get to your station, when you get to your chair, make sure the needles are still in the packet, like that, right? Make sure they're still in the packet and they open it in front of you. If you go to your chair and you know that blue pad, let me move this banner right quick. You know that blue pad, the chucks? If you go there and your needle's sitting on that blue pad and it don't have no cap on it, don't let them stick you. Tell them you want another needle. If it's sitting out like that, and if it doesn't have this cap on it, like that, you see the difference? If it doesn't have that plastic cap on it, don't let them stick you, because germs is on that needle. And if it goes inside you, you can get a bloodborne infection. In fact, you can get an access infection. So don't go for that hocus pocus. Do not cough or sneeze on your access, especially with this COVID. All right, wear a glove if you are holding your access site after the needles are removed. Make sure they glove you up too. All right, apply gentle pressure where the needles were removed. And speaking of that, don't let them tape you down tight. If you were bleeding and they want to tape you up real tight, strip it around and it's to the point where it's leaving indentations in your arm. No, tell them to take that shit off and tape it right where it has light pressure on it. Because if you compress your access, you can subject it to clotting. That's why we tell you don't sleep on that access arm. When dialysis caregiver is working near your access, he or she should be wearing a surgical mask or face shield. All right, don't let them. A brother, Brian Borley, said a patient coughed on him or sneezed on him when he was a patient. When he was a caregiver, and somehow he got sick and he ended up with kidney disease. I don't know if the two go hand in hand, but he said he got vaguely ill behind that. So protect yourself, guys. Be sure needles are rotated into new sites for each dialysis treatment. Continuous sticking in the same area weakens that area and causes for aneurysms. You've seen them, the people with the knots, warriors with knots on their arms, that come from aneurysms from sticking in the same place each treatment. I know it hurts going into a new spot, but you got to do it to maintain the integrity and longevity of your access. So you rotate those needles, please. Blood pressures should never be taken on your access arm, period. Not in the hospital, not in the nursing facility, not in dialysis. It should not be taken. Outside the dialysis facility, blood should not be taken from your access arm. If you got to go to Quest, LabCorp, in the hospital, I don't care. No one should be drawing blood from your access, period. Now, this is very important, guys. You got to listen to this, especially if you got a family member on dialysis, and for our older dialysis patients that don't have no one to look after them, we got to make sure we check their access too. Now, we got to look for signs and symptoms of infection and report that immediately. We're talking about swelling, redness, drainage, heat, pain, fever or chills, all this coming from your access, and you having fever and chills with these other symptoms. Also, the absence of vibration, which is the thrill, or the sound, which is the bruit. And getting into that, you want to do the look, listen, and feel. You want to look at your access, raise it up if you have a fistula, and see if it collapses, right? You want to listen to it, right? See if it's working. Then you want to feel for the bruit. Use your access site only for dialysis. I kid you not, I've been in a unit where some warriors use their access to inject drugs. That's the cold, hard truth of this disease. Be careful not to bump or cut your access. Do not wear jewelry or tight clothing over your access location. Do not scratch your access. Fingernails can cause infection. Do not sleep with your access arm under your body or head. Do not lift heavy objects or put pressure on your access arm. Check the pulse, which is the thrill in your access every single day. Now, if you got to access care for the catheter, be sure your catheter has a clean dressing. And as I showed you, some units use this. Some units, bear with me, family. Some units use this. All right, you see the difference? Right? And then some places, I don't work for them no more. When I work for DaVita, and all you guys that go to DaVita, they may do this. Take a pad out of here, right? And put it right there and put some tape around the edges, right? Tape, put a strip across there, a strip to come down there, strip to come down over here, and then the strip to go across the bottom. How many warriors had that done with just this, just like this? You didn't have this, the professional look, right? You didn't have this. You had this bull crap with tape, and then when it's hot outside, it comes off. Now you're subjected to an infection because your access is exposed, right? Where's that catheter at? That catheter is exposed because it doesn't have a dressing on it like it should, right? So you got to be careful. Your catheter should be checked for signs of infection at each dialysis unit. Each treatment. Clean gloves. Make sure these guys change their gloves when they get ready to change your access dressing. All right, don't let them go somewhere with the same gloves, come back and change your dressing. No, tell them to wash their hands and put on a new pair of gloves. Even after they pour that dressing, that dirty dressing off, tell them to change their gloves and put on a new dressing. Clean gloves should be used when your caregiver works with your catheter. You and your dialysis caregiver should wear a surgical mask when you are being connected to and disconnected from the dialysis machine. Keep your catheter dry. Do not shower or swim. Report problems with your access immediately. Again, signs and symptoms of infection from your catheter. Swelling around the access site. Drainage. Redness. Heat. Pain. And if you have fever and chills. Again, wash your access at all times, every day at home to prevent infection. And if you had treatment, be careful with covering your arm up with a blanket. I've seen some patients' needles come out because technicians don't take the time to connect the lure locks. Then when they rush in, I'm not saying it happens all the time, but it does happen. Because if it didn't, they wouldn't tell you not to cover your arm up. Evidently, that experience happened. In fact, someone lost a loved one where their catheter line came apart, right? And they bled out to death. Yes, unfortunately, these unfortunate and appalling accidents happen because of human error. So, just going to go over a couple more things and we're going to call it a night. And I want to read the comments. Now, again, quick access check. Look, listen, feel. Check your access daily. Again, look. Do you see any changes in skin color, redness, shiny skin, worn away skin around your access? Have you ever seen someone with a fistula, or have you ever had a fistula and it was pink around the access, like an aneurysm? It was raised up and the skin was pigmented, reddish. Look for that, because those where you can get those infections from, going in the same site. Now, these could be signs of an infection or one brewing to an infection, like pus or crust at that site. Listen, use a stethoscope. Go to a pharmaceutical store, medical store, or any nursing store where you can get a stethoscope so you can listen. If you can't afford one, you can use your ear, depending on where your access is at. If it's down here, you can do that. Up here. Now, you should hear a low pitch. All right. What you're listening for is a low pitch, continuous whooshing sound, like whoosh, 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 but it's low pitched. Now, what you don't want to hear, or what you want to have concerns, if you hear sounds more like a pounding pulse or a whistling noise like a tea kettle, that means your access is narrowing. That is, it's closing up, right? It's closing up. And how many warriors go to the access center every so often so they can stretch it out, or as they call, clean it out, right? Or you may have stents to keep your access open. Now you want to feel. Gently rest 2 clean fingers. Wash your hands before you feel your access. On your access, being careful not to remove any scabs that may have formed after treatment. If all is working well, you should feel a continuous soft vibration under the skin. It's like, imagine you're holding a kitten. When the kitten purrs, you might feel a soft vibration. That's how your access should have that similar feeling. If anything seems strange or wrong, please reach out to the access center or to your surgeon. I say always go back to the guy who put that access in your arm. Who else knows your arm better than the guy who did the original work? Just like the person who wrote the instruction manual for humanity, for human beings, the Bible. You always go back to the instruction manual. So you go back to the surgeon. Why go to the access center for something they didn't create or do? You always go back to your surgeon who created that access. Now, if you don't like them, that's a different story. Now you go get a second opinion and you find another surgeon. But I always, like, if I was on dialysis and I had an access, and first of all, I would find out who is the damn best surgeon in the area for vascular access. That would be number one. I wouldn't just go to the surgeon that the nephrologist or the dialysis people use. I would first, I had my catheter in, and I would do my research. This is coming from me. This is what I would do if I was in that situation, bar none. I would keep this catheter in until I made a sound decision on whether I'm going to get a fistula or a graft or I'm going to do PD. No one is going to bully me or push me into making a decision that I'm not comfortably ready to make. So if I decide to get a fistula, I'm going to find out who that damn best surgeon for vascular access in the area, period. Who does everyone go to? Whose schedule is always booked? Who has the best ratings, the reviews? That's who I'm going to. Yes. I'm not just going to anybody where you jacking up my arm, not knowing what you're doing. You could have done one thing, but you did something else. No. And then if I'm not happy, then I find another one. A lot of patients don't know this in dialysis because they get herded into the unit and everything happens so fast. It's like, damn, what just happened? So that's why we do these shows. That's why it's important. That's how we beat kidney disease. We may not be able to stop these facilities from proliferating, but let them proliferate. What we can do is decrease the numbers to keep people out of them units and keep them empty. Let's flatten that curve. Let's flatten kidney disease, the curve for kidney disease, the 9th leading cause of death in the United States. COVID doesn't fall on that 1 to 10 scale of the leading cause of death. Hell, we don't even know if the numbers are even true that they putting out about the COVID deaths. It's like when somebody dies, COVID, COVID, COVID. But we still got kidney disease. We still have it. People are still getting access put in, still getting catheters, still getting stuck by needles. That's for real. So let me just give you some information on caring for your graft. And it's the same thing as caring for your fistula. Again, your graft, your fistula is one of the preferred access types for hemodialysis. Keeping it clean and well maintained can help you stay healthy and out of the hospital. The more you know will keep you out the hospital from getting bloodborne infection or access infections. This is how you do it. We know germs are everywhere. Germs are everywhere. On the door handle, when you open the door to go into dialysis, the bathroom door, right? You're not the only person that goes into the bathroom in dialysis. Unfortunately, there are people who use the bathroom that don't even wash their hands. And if you're touching that door handle, you don't know if it's unseen fecal matter on it or what type of germs are on that door handle. You got people coming in and out of dialysis, touching the door, going into the treatment room. People touching the counter, people touching the scale when you get on, and if you got to hold the bar. The dialysis people that don't clean that. The cleaning people don't clean that. So look, if you have to touch your graft or fistula, wash your hands for a full 30 seconds with soap and water. Please, your access depends on you. It takes 30 seconds to clean all germs from hands. Wash your graft or fistula before dialysis. Dialysis needles can push germs. This is the information coming from the dialysis companies that I accumulated over time is telling you, but the people in the unit don't tell you, but the clinics have information to share with you that they don't. Dialysis needles. Okay? Dialysis needles can push germs on your skin into your body. Clean your graft with antibacterial soap and water for 30 seconds before every treatment. Gently pat it dry after cleaning. If you do dialysis in the clinic, stop at the sink on the way to your chair to wash. Now look, can you imagine this going in your arm and say your arm is not clean? You can't see germs. You can't see germs with the naked eye. And can you imagine those germs getting pushed in your access? Some technician, some new tech or nurse, not cleaning your arm correctly, not using sanitary measures, got on dirty gloves, right? Stick your arm. 2 days later, you have an access infection or a bloodstream infection. You want to know how the hell that happened? How did that happen? You won't even know how it happened because you weren't aware of the mistake that the technician or nurse did. And that's why these education moments are so critical for one to know if they do in-center dialysis, because they need to know what the technicians need to know. So then if the technicians or nurse are doing something wrong, they can correct them on the spot before they do any damn damage. Your life is on the line. If I don't have the consent form and what all risks that patients are at risk for on dialysis, the contraindications, I wish I would have brought that here to share that. It's so many things that you have to be focused on, but I understand if you can't focus because you're trying to get used to dialysis. So why would one want to focus on something that they have no knowledge about, but put that trust in the caregiver's hand for only the caregiver to fall short? Because to err is human. So let's talk about protecting your lifeline and what you need to know so when you go back to dialysis, You could be armed with information to protect your lifeline. Your access, your graft, your fistula is fragile. And you want to make sure that it's protected. It needs to be protected, and you're the best bodyguard. You can prevent the aneurysms. You can help decrease or minimize the infiltrations that technicians may stick in your arm and not paying attention and put the needles in without looking or rushing and go through that access. You are the bodyguard of your access. You got to be the protector. Again, it starts from not allowing labs, blood draws, or IV in your fistula or your graft. Have them use the other arm or find other veins in your body to draw blood from. Do not allow anyone to take blood pressure in your graft arm. Again, tell them to take it in your leg, the other arm, below the wrist. Warrior, you know what I'm talking about. Down in the ankle right here. You know what I'm talking about. You take the blood pressure down here. Avoid wearing tight clothing on your graft or fistula arm. I'm talking about that stuff that had that elastic that can put a mark in your, don't wear no tight clothing on there, or, rolling up your sleeves on your access arm, because that can compress it as well. So with that, like bracelets and watches, wear it on the other arm. And then try your very best not to sleep on your arm with the access, with the graft or fistula. And if you do that, rotate your sights, make sure, I even encourage you to stick yourself. All right, so I'm gonna move on. This is for PD catheter, and I'm just going over it. I know for the warriors that do PD at home, they pretty much got things under control and handled. So, I may have some information that could benefit you. If not, just let it fly over your head and keep doing. And I commend you on doing what you're doing to stay peritonitis free and doing your best to live your best life at home with peritoneal dialysis. However, on the other side, if you just got your PD catheter and you haven't seen your PD nurse, or you got some concerns, or you may be even thinking about going to PD and you want to know about caring for the catheter and all that, then this may be for you. So caring for your PD catheter. Again, just like the hemodialysis catheter and the fistula and the graft, the PD catheter is your lifeline if you decide to do that. That's a lifeline to dialysis as well. Keeping the exit site clean and PD catheter intact, which is very important, it's critical, can help keep you healthy. Now I'm going to come up with some tips, and then you can follow your doctor's advice from there. Keep your PD catheter clean. Again, the world is full of germs. We know that, and unfortunately, germs love catheters because it's, it goes under your skin. It's man-made. People put tape on it, and germs just attract to that type of objects and stuff. So why? PD catheter is like a door into the body. It lets dialysis fluid get into and out of the body, but germs can also use this door to sneak in the body. So we have to keep germs away from PD catheters. Wash your hands. Most germs get to the PD catheter from your hands. So it's critical. I can't stress that enough. It's critical to have totally clean hands before beginning your PD treatment or anytime you touch near your PD catheter. The team will likely ask you to scrub your hands for at least 30 seconds with antibacterial soap. I encourage you to do it more than 30 seconds. Scrub your hands all over. Germs can hide under all the creases and crevices of the hands, especially under the fingernails. So definitely watch out for that. Also, sanitize your hands. After cleaning your hands, use hand sanitizing gel to kill all leftover germs. You want to use an alcohol-based sanitizer with at least 60 to 95% ethyl alcohol, isopropyl alcohol, or both. Have that word pronunciation. But follow the instructions on the bottle. Always sanitize your hands before touching anywhere near your catheter or dressing. Again, this is how you protect this lifeline. It's very important. Do exit site care daily. All right, your clinic can give you instructions. Avoid tight clothing. Avoid sleeping on your belly or abdomen. And some warriors who got these catheters and hear this, they may do other stuff or may challenge me on some of this, like avoid tight clothing or sleeping on your belly or abdomen. Because I don't have a PD catheter. I'm just going by what the education information says. So I know everybody is different. Keep your catheter secure at all times. Ask your dialysis team for tips to keep it safe, comfortable, and hidden. I mean, you can ask other warriors who do home peritoneal. I'm sure they have a lot more information than the dialysis clinics on coverings and how to keep it tucked in and all kind of things, and keeping it sound and secure. Do not swim in river, lake, creeks, ponds, or public pools. Check with your doctor to see if any swimming is allowed for you. Again, some warriors may challenge that, but again, check with your nephrologist before you take the dive in. And it says also do not use hot tubs, whirlpools, or bathtubs. And I probably wouldn't blame them if other people are sitting in the whirlpool. You wouldn't want that germs or dirt from other people kind of getting on you as well. So a clean and protected PD catheter can help you get years of good dialysis. It's your connection to getting life-saving dialysis. Try your best to treat it like gold. So that's it. I got a lot of comments, like 46. God bless you. I got Melissa. I can't wait to have her on. Melissa Tough. I used to sleep on my stomach when I beat Heather, but they never told me not to. Would have been good to know when I had. Did it cause you any problems when you did sleep on your stomach? Hey, Kathy. I'm not at work because of COVID and being high risk. Hope to find home job. Okay. Unfortunately, it's so overwhelming for some. They prefer to turn their care over to the techs, trusting they are doing. You're right. You're right, Melissa. Sure is, Kathy. Let me go to. Absolutely. Thanks for watching, Lakeisha. Appreciate you. Courtney, thank you, babe. It's definitely a huge distraction. Courtney, thank you. Let me see. Dr. Haki is the bomb. Okay. Yeah, I heard of Dr. Haki at the hospital center when I used to work there. Yep, absolutely. Yeah, absolutely. Yes, me too. Yes. Yes, absolutely. You got to, man. You got to. Okay. Wow, Kathy. Yeah, Melissa, Kathy. Thank you, guys. Let me see. Oh, Miss Betty, how you doing? Wow. Hey, Don, thanks for watching. Yeah, absolutely, Don. With the needles in the package, because it happens all the time. In fact, guys, I'm not going to lie. I've been guilty of opening the packet. Like if I had a patient assignment, I would open it up, but I wouldn't take the tip off the needle. But now, if I was to be put in that situation again, I know better. See, when you know better, you do better. But the practice is still being done. Uh, Let me see. Miss Betty says, one of my patient friends made a choice to keep his catheter. His doctor told him it couldn't be done. He's had his catheter for 12. See, I told you. I mean, I know people. I mean, that's what I'm saying. I mean, I don't listen. I'm not saying or condoning. You're right, Martin. How you doing, brother? Thanks for watching. It's what works for you and you doing your research. All right, but when you do that research, if you have all the facts in front of you, right? If you had all the facts, like this paper right here, that has the graft, the fistula, and the catheter, and if you had this when you're at the hospital, right, that they can give you when you're discharged, so you can read this, right, to make a decision, to have the information in front of you to make an informed decision on what to do that's going to be impacting your life for the rest of the time you're living. That's all I'm saying. So that's why it is key, critical for this information to be shared with loved ones, with family, with friends, because kidney disease has no name or number on it. It doesn't care. It doesn't care. So, hey, Liz, how you doing? Oh, let me see. She says, are family members not allowed to be trained so that I can provide this care for my son when the time? Yeah, I would take that step, because you as guardian, his caregiver, yes, learn whatever you can about catheters or whatever you need to do to provide the care to your son, so you don't have to depend on other people or have or worry the anxiety if they're doing it right, because they're subject to misstep or bypass or rush or whatever they need to do to hurry up and get the work done. You know, when you got people working 14, 15 hours, 3 days a week, and they may work a part-time job at another dialysis facility on Tuesdays or Thursdays, these people are tired. I've seen people come to, how many warriors go to dialysis facility and you seen the technician come in late? Not saying that problems don't happen, but have you ever seen a technician come in late if you come in at 6 in the morning or your machine is not set up because your technician hasn't arrived, or you go on late? You know why? Because they overslept. You know why? They tired as hell. You know why? Because they work 6 days a week. Because they getting paid, maybe they working at Fresenius getting maybe 24, 25 an hour. and they had DeVita making $19 an hour. Yes. I know people work 3 dialysis jobs. So would you want someone who's working, say, 60 hours a week, maybe up to 100 hours a week, working on you? As I close out this broadcast, would you want someone working 70, 80, 90 hours a week, sticking needles in your arm and doing a high complex procedure, which is life and death, because you can die on dialysis if something goes wrong? That's the truth. Would you want a technician working on you that's worked 90 hours in 1 week? That's where all these clinics come into play and the patients suffer that I was talking about. You build all these clinics and you don't have staff, and you put out notice to other sister units that you offer these incentives, these bonuses for technicians to work overtime. They see it, they go, they respond, and now they got 70, 80, 90 hours a week, and they coming back doing a highly complex procedure on your loved one or on you, that one mistake, because we know to err is human, that one mistake can cost you your life, your loved one, your mother, your father, your uncle. And if you don't believe me, reach out to Kidney Warrior Donnell, not Dar, but Donnell, Donnell, Carly, C as in Charlie, A as in Apple, R as in Romeo, L as in Larry, E as in Echo, Y as in uniform. Donnell Carly on Facebook. And ask that kidney warrior what happened to him because a nurse not paying attention caused a serious medical complication that led to an air embolism that led to a stroke and sent this gentleman home. So, again, just pay attention to what's going on around you with these nurses and technicians in all these facilities. You don't want no one working on you that works 80 to 90 hours a week. Anytime you hear someone come to you and say, I'm tired, that's the time you ask for another technician and ask them, are they tired? You need someone with clarity, focus, integrity, aware of what's going on when they're putting you on dialysis. Because at the end of the day, patient lives matter. Elizabeth Santiago, I pray your son doesn't ever need dialysis, but if so, you could see if home dialysis is an option. Yes, Elizabeth Santiago, if this happens, you can reach out to the Urban Kidney Outreach Media Network. Don P. Mormon Edwards is a kidney warrior and home dialysis expert, advocate, and patient herself. And she can direct you in how to navigate through this process to make you feel comfortable and secure in treating your son in the comforts of your own home. So Liz says, thank that you walk. Unfortunately, since the last chemo option is not working, it might be the case. Mr. Lupus has decided to make kidney his friend. Again, sorry to hear this. And also, Miss Elizabeth, reach out to, and I know she doesn't mind me saying this, reach out to Kertisha Ray Anderson. She's also a lupus survivor, kidney warrior, transplant warrior, and she works with the Lupus Foundation, and she can give you any information or support that you may need to work through that situation as well. I saw something with Melissa right quick, and then I'm going to end. I thank you guys. Share this broadcast, guys. This is how we, flatten the curve for kidney disease. That's the new saying. Let's flatten the curve for kidney disease. That could be our own moniker for this community. My techs at DaVita would get frustrated and rush through stuff because they have such a... Man, I can't wait to have you on, Melissa, because you can verify everything that I'm saying. They want patients in and out as quick as possible so they can get more people. Yes, man, it's going to be refreshing to talk to you. Wow. I mean, because that is the truth. Some people experience it, some don't, but it happens. So with that being said, thank you guys for watching. Man, this has been a great show. I didn't expect to be on damn near an hour and a half, but education is key. As they say in the Bible, something to this saying, my people perish for a lack of knowledge, and I shall not let the kidney disease community perish because of lack of knowledge. I refuse to. Yes, Melissa says PD is the gentlest home treatment, but home hemo is the gold standard. I've done both, so if you have any questions, I'm happy to. Yep, that's also Miss Liz. A great resource person. I forgot. I'm sorry, Melissa, but even with inspirational from Ayana Van Zant to information on home hemo, reach out to Melissa Tuff as well. I mean, heck, it's a lot of people out there, and I'm glad people are coming together to help new people, because that's how we do it. As James Fabian says, Dad Vice TV, kicking kidney disease to the curb. I just wanted to say that, James. So, guys, thank you for watching. I love you. Don, call me tomorrow or something. It's good to see you online. You got to be on here more often, because people need you, man. They need that education about home dialysis. They want it, and they need the education, and the more we give and share, the more that people will be educated and know if they ever fall into a situation where they need to leave their center, or they blackballed or blacklisted because they made a legitimate complaint and the clinic just had it, then you can go home and do it at home. But I guess you would have to find a home program. But I'm sure there's other places that do home dialysis other than Fresenius and DaVita. A lot of people coming out to Gate now and offering this service because they see the need for it. So thank you, guys. I just want this community to grow exponentially, just like the cancer community and all the other communities that support each other and the members that's in it that's suffering from the same disease. I mean, we got to do the same thing, you know, whether you live in Beverly Hills, California, to Key Largo, Florida, you know, Mississippi, or Alaska, whether you're rich, whether you're, you know, poor, you know, black, white, regardless of your religion. You can even be racist. I mean, hell, you know, with all that being said, wherever you fall under, and if you got kidney disease, you're connected to this community, and you're not, what's the word? You're not, you know, going to get this information because of your beliefs of how one believes, whether race, whatever. Not going to deny anyone of any type of education that benefits them to live a quality life, especially kidney disease. And that's, I mean, and I've actually, you know, when I traveled, I had a person who didn't want me to treat them because of my skin color when I did acutes up in Reno, Nevada. I mean, I thought it was funny, but at the same time, I mean, it's life. It is what it is. I mean, I still got paid. That's the thing about it. You know, when that happens to me, when I was working in dialysis and a person said, I don't want the black nurse to work on me, I was like, oh, damn. And so I had to tell them they had to send someone else out, you know, a white nurse. And I just went to wherever she was. We switched. I mean, I still got paid, but I mean, it was heartening that, you know, a person was sick, and even in the sickness, that he still didn't want a black guy or, you know, person of color to work on him. So just thought that was funny, and just part of my experience as a nurse. So Melissa said she had to switch to American Renal Associates because the Vita refused. Oh man, that's cruddy. That is cruddy that you had to go to another corporation because one corporation who talks about she gives life. See, that's what I'm saying. Melissa, don't get me on my soapbox, because you know, this is where I say the propaganda comes into play. Melissa says she had to switch because the Vita refused to let her do solo home hemo. That's where I mean when the Vita has in their units right now, community first, a company second. No, it's the other way around. A company first. Let's not get that twisted. It's a company first, then a community second. That's how it works. But in their doorway, when you walk into some of their new units, it says a community first, a company second. But I'll argue it's a company first, and then it's a community second. Yeah. Elizabeth, don't feel bad. My son only wants women. Right. Nah, I mean, you know, that's just life, and it is what it is, Miss Liz. So, you know, we're going to definitely be praying for you. And here we at Urban Health Outreach Media sending positive vibration, thoughts, prayers, and energy your way, to your son's way, that he bypasses this by some miracle, and he lives a healthy, quality life. However, if for yourself on the other side of the fence, we are here for you, and whatever we can do to help the transition go smoothly without or of reducing that anxiety, then we're going to do it. Yeah, I saw that. With the DeVita where he talks about Ken Theory. You know, Ken Theory is not there anymore. It's Javier Rodriguez. But he's probably the same, Ken Theory. Them guys up there, man, they still doing the same, getting paid by Warren Buffett. Thank you, Kathy. I appreciate you. Look, guys, let me say this before I go. I don't, it's not the clinic itself, because I know a lot of you go to Fresenius, DaVitas, and people are going to be people, whether they're a registered nurse, an LPN, a dialysis technician, administrator, and these people got different beliefs, behaviors, morals, norms, and sometimes you get clinics that have a great combination of people that work together, camaraderie that makes the patient's dialysis experience at that clinic phenomenal, that they don't want to go anywhere else. That happens on both sides of the fence. It happens in DaVita, Fresenius, America Reno, Reno, US Reno, wherever clinic. You may have that experience, but then you may go along the continuum of that and be at a clinic where you have horrible experience. I witnessed all of it. I've been to a clinic with patients, all Black unit, all Medicare, Medicaid, only one white person out of this 20-something chair unit, and yet they, when I say they, DaVita, found it okay to renovate. When I say renovate, I'm not just talking about putting up wallpaper. I'm talking about ripping up the clinic floor till it's a cement slab. I'm talking about dust coming into the unit in the morning, in the air, on the television chairs, on the television handles, on the dialysis chairs, on the counters where the meds are, on top of the counters. All right. This is what I'm talking about, where mold is detected back in the water room, and you got plastic black hoses acting as the water loop instead of using the PVC pipings because the loop is down. That is appalling to renovate and have dust in the air, especially with patients who have catheters. You could have moved these patients to other units until you renovated. But did that happen? No, it didn't happen. Now, I could go right now and pull up. Hold up, guys. I'm sorry. I got to do this. Stay with me. I'll be right back. Stay with me, guys. I want to show you something. I'm going to give you a grand finale. Just stay with me for a moment.
walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not kept them.
All right, guys, so I'm back. I'm just trying to get to my photos. Give me a moment. And I want to show you something. I'm going to show you something that's very, very appalling. Just going into my files right quick. I mean, this is absolutely ridiculous. Hold on. And this is going to be for anybody who goes to dialysis or they take their family member, and you tell me if this is all right. Wait a minute. Looking for these pictures. All right. Wait a minute. Wait a minute, I'll pull up one. Okay, so if you was going to dialysis, how would you feel about that? Come on, somebody comment. If your dialysis unit, if you was going to dialysis at a dialysis unit and you saw how much they charging you, right? They charging your insurance, and you had to go to a clinic and see that. How would you feel? Seriously. I mean, how would you feel? I'm trying to, can't pull up like several pictures at one time, so I'm trying to go back to other pictures. How would you feel? What about this? What about this? If you was going to dialysis and you saw that, what would you feel like if you was going to dialysis for like 3 weeks and that was like that for 3 weeks? I mean, come on now. How would you feel? And they charge you, $2,000 treatment or something like that. You get this bill and you going to dialysis in your clinic like that. Wait a minute, I ain't finished. I mean, what would you do? This was a DaVita that makes millions of dollars, billions, okay? Billions of dollars. Each clinic makes millions. And you would tell me you coming in like that and you got to be subjected to this? Hey man, I'm just finding my other picture. That shows you that. Shows you. Oh. What if you had to go to dialysis, right? Before COVID, and you had to sit down in that chair with that like that. You see the machines in the background? What would you do if you come in there and you see that type of work in your clinic? How would you feel? It'd be like, damn, they doing construction under my nose and I'm paying money. When you go to your dialysis unit, you want to make sure all that is covered up and you going into a sound professional unit, not one where they're building this crap and you seeing the process. You paying your money to see the process of a unit get restructured when that shit should have been like that before you got there. Yeah, don't get me started. And let's take a look for the people. Look about infection control, right? Infection control. What if you go there and these gloves are on the wall, right? We got a box of gloves that staff uses, and you see this dust on it from the panel from the ceiling. That's what that is. That's what that is. Now, what would you do? You don't know. You sitting in the chair waiting for dialysis, me to do dialysis, and I go grab some gloves out of a box that got that stuff, that type of paneling that pushes up, that flaky stuff can fall down. I can't think of the name of it. And now that stuff on the gloves, you don't even know it. And you paying this money. Again, I don't know about you, but I find that highly unacceptable at a dialysis unit. Look at this opening in the wall. This is unacceptable. But yes, this is what people go through that a lot of people didn't even know about. This was my reality. This was my reality. This is not a disgruntled employee. This is an employee who's trying to shed light of what's going on in a company that's supposed to be $1 billion company. So don't tell me, oh, he disgruntled. We trying to save lives up in here. All right? That's atrocious. It's trifling. And it's unacceptable. Dust, ceiling dust on gloves. And gloves are supposed to be clean for infection control. Unacceptable, guys. Absolutely, Melissa. Absolutely. Absolutely. So, guys, this is what's happening out there. It's still happening. There's clinics out there that don't give a damn. They got taken over by the Vita that say, let's just keep it like that and not upgrade. So I just wanted to put that out there to let y'all know I'm not just talking out the side of my neck when I talk about these units. I got the proof is in the pudding. Now, to be fair, since these pictures were taken, the unit has renovated over, right? But it just shows you how these units don't care if you're a patient there. They'll wait at nighttime to do the construction. Nobody want to come in here and see this shit when they go to dialysis. I mean, and just like Melissa said, some patients could walk in there and hit their leg and scrape it, especially if they got diabetes type 2. You nick your leg on something like that, It's hard to heal, turn into a wound, gangrene. Next thing you know, it's off with the leg. Come on, guys. Are you kidding me? Look at that piece sticking out like that. People was at risk. And I didn't even think about it until Melissa said something. So this is real. This is why it's important to advocate for yourself and to consider home treatment if you're in dialysis. Yes, Courtney, this is where I used to work at Union Memorial Hospital in Baltimore, Maryland. They were transitioning and doing reconstruction, and they did it at night. The people came in at night, and you saw the patients saw this in the morning. This is part of it as well, right? Here we go. That side. And then you got the cement dust on the gloves that's on the wall and the glove holder. Do you think they told patients about it? Do you think anybody said anything about this? No, it was business as usual. This is what I talk about. Business as usual. Yes, they cleaned it up, but what about before cleaning it up? People went through this. Patients actually went through dialysis experiences. I worked at that time. It wasn't closed down. So let me answer it. Man, I know, but it's gone now. I mean, when I say it's gone, that it looked like a brand new unit. But this is what people went through, and this is my beef, man. That again, a lot of people I've seen from one end of the spectrum, people experience that, to high end where people didn't experience that. It was all gravy. All gravy. So that's just the reality, and look into the reality of these clinics and the money. Like a lot of people say, it's the money. It's the money. They save on it, wait to pay it, so they can hold on to that money. But yet patients are steadily, what's the word, at risk, and they pay the price. That's why I say the patients pay. They pay. They pay with stuff like this. They pay. They pay. Infection control. Where's the network when you need them now? Where are the agencies that does an inspection when you need them? Where are they? Are they in cahoots with the clinics? Where are they? Now, as I close, next Thursday, mark this on your calendars. This is going to be a show of all shows on Urban Reno Talk with Tamika and Steve. Next Thursday, the 28th at 9 p.m., we will have a social worker who used to work for DaVita, who was blacklisted, blackballed, because she had a complicated pregnancy in the hospital. You're going to hear her story, and she's going to tell you all the things. And she's not a BSN social worker. She's a licensed clinical who worked for a couple of years and experienced the blatant racism and injustice from this organization, the Vita. And she's going to share how patients suffer from a lack of non-reporting and other methods that are unacceptable. A lot of patients don't know when they report grievances, each unit has to have a grievance book. So when patients file a grievance, it goes in that book, internal. That's internal. But guess what happens? And the social worker will explain it. Those grievances get ripped out. They get ripped out. So now when inspection, people from the state come and they say, oh, let me look at your grievance book. There's nothing in it. So now who are they going to go to ask about the grievance if they don't know that one was ever created? This is how it works, guys. So don't let these clinics fool you. Continue to do what you got to do to learn your treatment, learn what you need to know to keep yourself safe inside outpatient hemodialysis, because we haven't even scratched the surface. And I'm going to share that night my experience when I filed anonymously with MOSHA, Maryland Occupational Safety Health, on those pictures you saw I posted earlier of the water treatment room. And it also had a pungent, awful odor that caused me to have headaches and dizziness. And I have medical records and filed. And do you know that MOSHA came back after the inspection and said they didn't find anything wrong? So who's sleeping with who? I don't know, but I will have the proof in the pudding to show you how these organizations get by, and patients that go to these units don't even know that sometimes they are at grave risk. Let me get these 3 comments and I'm out the door. Yes. 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 That's crazy. Absolutely. Absolutely. Melissa said, Maddie Legal, what happened to you? I'll tell you, Martin. So, Martin, as a charge nurse, nurses, you don't have to be a charge. Well, yeah, the charge nurse has to go to the water room and check the water for the dialysis clinic at least every 4 hours. We're checking it for chlorine and chloramine. In this particular place where I worked at, this unit, it has been around for more than 20 years. So, of course, downstairs, never been upgraded or whatever. No one never cleaned up down there. So, by this time, DeVita took over when I came back. But this water treatment room was so disgusting that it had this odor that I don't know what was in the air. right? And you see some pictures of me, I had a mask on that had a filter because these guys was renovating down there, doing work, cutting in the cement and stone and all this dust in the air. I don't want no damn celiac disease, but nothing to protect us. And I complained anonymously. And apparently it was looked into, and I got a letter back saying that they didn't find anything. But I want to have the letter. I want to have it with me, get it out and read it. And this is just to show you guys, this is not to like pick on these companies. This just to show you that even though these companies look good on the outside, they're damn dirty on the inside. And I just want each patient who go to these clinics to be mindful and inquisitive and educated on their treatment so they don't fall victim of any type of hocus pocus or unsafety measures that could put your life at risk. Yes, I was exposed to toxic chemicals. Yes. Not just me, but other nurses as well, but they didn't want to complain. So, all right, guys, I've been on here a long time. Yeah, I want to try to get there, Elizabeth, Chicago, to try to bring light. I ain't going to lie. I'm going to be straight up about Chicago. I just don't want to come there and get shot, man. That's my biggest fear in Chicago. And I'm just being honest. I hope, I'm sure that's probably in the hood, but you may not even have to be in the hood to be victim of a stray bullet. But stay safe out there. And I will. If the Lord wants me to go to Chicago or calls me there, I'll go, because again, we all have a time stamp on our life. We just don't know when. And that's the thing. We just don't know when. So God bless y'all. Thank you for watching. And thank for the 13 people who stayed on here regularly for almost 2 hours. But we're going to see, Liz. We're going to see, definitely. I went out to California, Inglewood, and traveled around there during COVID, during their worstest moment. So if the Lord got me, through that and back here safe, I just put my life in his hands. So thank you, God. Thank you. So thank y'all for watching again, and tune in tomorrow. It's going to be a great show. Lisa Baxter, 8 o'clock. And then I'm going to be with Cassandra Floyd at 9 p.m. on World Kidney News, the around the world dietitian who's traveled with her husband because he's in the military, Lieutenant Colonel, and she has a vast range of knowledge and experience and a story with kidney disease and being a master's prepared renal dietitian. That's tomorrow night, guys. We're going to give it to you all we can to help you live a better life, even with kidney disease. God bless you, and thanks for watching. Have a great evening. Enjoy your weekend. Peace. We see you tomorrow.
I've been walking beneath streetlights. I've been walking, cause I can't find peace on these nights. I've been walking, but my strides are getting slower. Still I'm walking, but I don't know where I'm going. I've been looking for love, but only found deception. Told my secrets to some people who have not.
This is the Polish Ambassador, featuring the Grouch and Scott Mace. Don't get it twisted.
I might be conscious, still I like to fuck. Do a little yoga, then lift some weights up. I be as I'm supposed to, perfectly imperfect. Indulge in deep combo, get hyped when she's